Good morning. This is Dr. Tariq. Today I am going to discuss medical terminology of the male reproductive system. Male reproductive system consists of two testes, two epididymis, and two vas deferens, one prostate, two seminal vesical glands, two bulbourethral glands, and one prostate gland. And there are different word roots for each of these structures. There are four word roots for testis. Number one is orchio. Number two is orco. Number three is orchido. Number four is testo. So we can say orchialgia, pain in the testis. Orco, we can make orchitis, infection of the testis. You remember, orchitis stand for both inflammation and infection. So it may be infection of the testis or it may be inflammation of the testis. Number three is orchidectomy, surgical removal of the testis. Sometimes we have to remove the testis because the young man is suffering from testicular cancer. The tumor in the young boys are usually cancerous. Testalgia. Testo is the another word root, so we make the word testalgia, pain in the testis. The word root for epididymis is epididymo. Epididymo stands for epididymis, and the word made is epididymitis, infection in the epididymis. This is the tube epididymis, comma shaped on the superior surface and the back surface of the testis. Epididymis. Then next is scroto. Scroto means scrotum. Scrotum is a sac that contains both the testes and protect them. So the word made is scrotal, pertaining to the scrotum. Then there are two word roots for sperm. One is spermato, the other is spermo. From the spermato we make the word spermatocele, swelling of the epididymis that contains sperms. Cele means hernia and swelling both. So swelling of this occurs at the epididymis. So swelling of the epididymis that contains sperm, that is spermatocele, and we made from the word root spermato. Next is spermo. From spermo I make spermogenesis. Spermo is of course sperm. Gen is to produce. Is condition of. Genesis is formation of sperm. Spermogenesis. Formation of the sperm. Next word is oligo. Oligos means scanty or less. The word is oligospermia, less sperm in the semen. We normally have 1.5 to 5 million sperm in one ejaculation. If they are less, then it is known as oligospermia. 1.5 to 5 million per ejaculation. Another word is aspermia. Aspermia, I told you, no without. So aspermia means this is a condition, ea means condition, which has no sperm. Some people are born, they do not have any sperm in their semen, and they are the one who cannot reproduce. Next word is prostato. Prostato means prostate gland. Prostate gland enlarged due to age. It is the age-related factor. Just like we develop cataract in the eye, we get enlargement of the prostate, that is known as prostatomegaly and abbreviated as BPH, benign prostatic hypertrophy. Benign prostatic hypertrophy. Prostatomegaly. So we have to remove it. Prostatectomy. We have to surgically remove it. Prostatectomy. Or we have to remove it through the urethra. The urethroskop goes through the urethra to the prostate gland and resect the tumor piece by piece, and then with the help of drip and Lasix injection, this comes out. These pieces are all drained out, and the urethra, which was distorted due to enlarged prostate and there was urinary problem, so it will become straight once again, and urinary problem will be controlled. The next word is balun. Balun. Balun is the terminal part of the penis, which is known as glans penis. The word root for glans penis is balano. Balano. From the balano, we can make the word balanitis, infection of the glans penis. Another important thing that happens here is urethra. We know urethra passes through the entire length of the penis up to the top, up to the tip. Sometimes what happens is urethra do not develop fully; it stops somewhere in between, and the opening is made on the inner surface of the penis. And when the child pee, the pee goes to downward towards the floor. That is known as hypospadia. Spadia mean fissure or split. Hypo mean below. So this split is made under surface of the penis. That's why this is known as hypospadia. The other possibility is that split is made on the top of the penis. Instead, this is not there. It plays on the top. So when child pee, it will go up like a fountain and then drop. So that is known as epispadia. The fissure is on the upper surface. Hypospadia, the fissure is on the under surface. The third possibility is the urethra stop its production and does not complete up to the tip of the penis. The fissure is made on the side of the penis, and when child is pee, the pee go to this side. If it is on this side, fissure, pee will go this side. If it is on this side, pee will go this side. This is known as paraspadium. Para mean on the side, beside or on the side. Paraspadia on the side, hypospadia under surface, and epispadia on the upper surface. So these the condition of the congenital abnormality of the urethra. Another condition is another word root is androgen. Andr mean male and gen mean to produce. So these are the hormones that produce the secondary sexual characteristics of the male, just like masculine body of the male, moustaches, beard, hairs on the chest and on the genital area, development of the testes and development of the testis, penis. They all occurred under the influence of androgenic hormones. Next word is crypto. Crypto. Crypto means hidden. Hidden. So what happens is sometimes baby is born with no testes. One testis is absent or maybe two testes, both are absent. The testes develop in the abdominal cavity of the baby, and they send out just before the delivery and or just after the delivery. So sometimes what happen is due to certain reasons they do not descend down. So on one side or maybe on both sides you will find no testes. This is known as cryptochism. Cryptochism means absent of testes. Phimosis. Phimosis is narrowing of the opening of the urethra, external urethra, or narrowing of the opening of the prepuce. So the urine becomes thin and the whole urine does not pass out. Some urine will stay inside and will cause the infection of the glans penis, which is known as balanitis. Varico. Varico means dilated vein. Just like we have varicose vein in the leg, we can have varicose vein in the around the testis. So the condition is known as varicocele. Varicocele. Seal has two meaning. One is hernia and the other is swelling. So this is the swelling of this epididymis that contains lot of sperm. Spermatocele. Or varicocele is a swelling of the veins that are present around the testis. The testes come out because testes cannot survive in the body. The body temperature inside is always 98.6 and the testes cannot tolerate 98.6. That's why they come out of the body. They can survive the temperature outside, not the inside. But if the veins are dilated, some blood will stay there always, and that will be temperature. The temperature of that blood will be 98.6 because it is coming from inside the body. And these people may lose the ability to reproduce. Either the sperm count will be less or sperm will be less quality, not good quality. That's why they cannot reproduce. Vesico means spinal seminal vesicle. These are the two seminal vesicles which make at least 60% of the secretion of the semen. So vesiculitis is an infection of the seminal vesicle. With that, I complete the medical terminology of male reproductive system. Thank you very much.